Yeah. Well, actually, I've been involved in some of that stuff before.
Hello?
The, sent on some wild,
Started in a few minutes. We're waiting for a link to potentially work for Jonathan Anna to join us remotely. Can get started. Call the meeting to Legislator Jonathan Anna, possibly joining us remotely, Stephanie DeVito, Legislator Petcher here, and Legislator Strong here. Motion to approve the minutes of March 6th.
Make motion?
Sorry.
Any discussion? Hearing none, all in favor?
Aye.
Passes. We have an appointment. This is for information only. It will be voted on at the full ledge. Dr. Heather Wasilewski for the Board of Health. So we will move to our department updates. I'll follow them in order this time. So I'll call up our department head, Kathleen Cuddy.
Heidi,
Yes.
Mr. Anna has joined us, I think.
Yeah. Oh, thank you. So we have officially marked you as present. Thank you, Jonathan, for joining us remotely.
How are you?
We are just starting department head reports with Kathleen Cuddy.
Would you like to go ahead and
Sure.
little update? So in the written update that I shared with people, I think it's great to highlight the number of people that WIC is serving. You know, I think one, it shows the work they do, of course, for staff, but it shows the benefit that the WIC program is bringing to our community. Most number of participants we've ever had, or in January. And that speaks to a lot of issues, right? But it's good that that people are engaging with the program. I shared some numbers on the programs for children with special health care needs. I think it's going to be, I think it's a good idea for all of you. We share these with the Board of Health a lot of times, but to get a sense of the number of children and families who are engaged in these programs also, and the wait list that we have. I asked our coordinator here to let me know that it's the date that she took these numbers from. So it was toward the end of March. It was March 22nd. But they're really for both early intervention and for preschool special ed programs and therapies. You know, the wait lists are only getting bigger, not smaller.
The 40 young people waiting for physical therapy, is that because of a lack of physical therapists or just the number of children?
So it can be any number of things. It may be where the children live, so that there may not be therapists in that area that serve that area. If you're not part of, like, if you go to a tuition-based program for if it's preschool, then the therapists are there and that's rolled into your program. But if you're at daycare, if you're at home, depending where you live and the availability of the therapists. I'm just gonna switch seats because I can't stand sinking in this thing.
Oh,
Making me
okay.
feel
I
like-
thought I had the chair.
We're gonna pick this one out so nobody else gets it. Right, thank you. So good to have some numbers and share that. And I'll try to do that every so often, just so you stay aware. And I also like to highlight the program. So the April place-based focus, our partnership with place-based is going to focus on neurodiversity with particular focus on sensory issues. And then they call it picky eating, right? So if your children are particular about the foods that they eat, what are some ways that you might be able to help expand their engagement in a way that doesn't, make everybody want to cry. So, we were asked to put together a measles action plan because, as we know, there's measles within the United States, which is not typical for our country. A lot of the situations are, people are either not vaccinated according to ideal timelines, have been exposed maybe from out of the country. They were traveling, or someone from out of the country came in who had been incubating the illness. That's the majority of ways. Measles is highly contagious if you are up to date with your vaccination, which in New York State, we're in a good position because children are required to have their measles vaccinations before starting school. So we, in Cayuga County, we have particularly good rates of measles vaccination. It puts you in very good stead not to develop the disease. No guarantees, but
So that early childhood vaccination protects for life, or does that have to be
Yes.
updated?
in the case of measles, you get the 2 when you're a child, and it should take you through your lifetime. If you were exposed to something, depending on your circumstances, if you're compromised or something like that, physician may recommend that you get a booster. But that's very individualized at that point in time. And we're going to be sharing, we're going to be attending kindergarten registrations around the area school districts. And as part of that, it's to let parents know that there are requirements for school-aged vaccination, and help also share with parents the other programs which may be available to them. If you have a kindergarten age student, it's quite possible you might have younger children in your household also, or other things that programs that the health department may be able to engage with to benefit. Like to school day, this really taken up. I'm really pleased for the number of school districts that aren't within the city that are able to participate, and that just we're adding, one more this year too. So I'm really, that's a fun thing, and
I
it's
remember
really good.
last year, there were big numbers at Moravia for
Yes,
bike to school.
yes, and that's about injury prevention. It's about rules of the road safety. It's about wearing helmets, being visible, things like that. Talked a little bit about environmental health services and the rental registry. This week is National Public Health Week. The theme is protecting, connecting, and thriving. We are all public health. I believe the legislature is going to be acknowledging this with a proclamation at the legislative meeting. We've written some articles. We're doing some highlights on our social media that highlight some of our division programs. So it's a nice way to bring some recognition to what our department does. We had a call just yesterday with local health departments and the state health department. We do have those every quarter, and that was a good opportunity to hear from the states with their new personnel who are in positions. They had a number of vacancies at time, and it's great to make those connections with the local health directors and the people at the state that we would be calling. And then they also spoke about getting measles action plans together. They spoke about avian flu. It's not an issue in New York State, but that was great to get their insight because the state veterinarian had spoken with the Texas veterinarian, and he was able to offer us all some insight. So that was very interesting for us. I also had a call, Auburn Community Hospital and the health department. I speak with them once a month. We have just a regular call to touch base and, see what's going on with our respective agencies and to keep each other apprised of things. During COVID, we had started this, and of course, we spoke a lot more frequently at that point in time. But they invited me to take part in their monthly calls also that they have with Upstate, with an epidemiologist there, because they work closely with Upstate Medical Center. And so I was able to take part in that, and that was very interesting also. It's not really new information necessarily, but it's great because it's graphical data that is shared. And so one of the topics that was touched on was the fact that some of the respiratory diseases, they appear to have peaked and are starting to come back down. So everybody knows we usually have like a flu season. So we're starting to get through, according to the data that we have so far, and it's based on hospitalizations. What we saw, the number of flu cases is starting to come down. The number of COVID cases is starting to come down, and the number of RSV cases is starting to come down. Still out there, not gone, but better than it was a month ago. And then I think there was one more thing. Oh, I think I was just gonna give a shout out to Riley in our emergency management, and I think a number of people here attended today's State Emergency Management Certification and Training Academy. I've had the chance to go to different FEMA trainings and other trainings, as required and as recommended over the years. And this was a really great summary, and a summary more so for me, but we had some staff members who attended that it was new for them, and it was well done, and it was efficiently run, and I'm glad that I went.
Thank you.
Yeah.
Thank you to Riley. So we'll move to your resolutions. HH1 is a resolution authorizing the public health director to fill the WIC program coordinator position due to an anticipated vacancy. May I have a motion for discussion?
I'll make a motion.
Second.
So we have a resignation of our coordinator. She's going on to pursue higher education. So we're glad for her. And we would like to fill this position.
Fully funded 100% federally.
It is correct. Yes, our WIC program, fortunately, all our personnel are completely covered under our grant.
Any discussion? All in favor?
Aye.
Aye. Any opposed? Carried. Jonathan, we can't hear you for
No,
voting.
yeah, I'm sorry. I was muted. Aye.
Okay, thank you. HH2, authorizing the chair of the legislature and the health director enter into an agreement with other central New York health departments for the purpose of mutual aid in regard to public health emergencies.
I move for discussion.
Second. This is something we've had for about 15 years. Every 5 years, we try to re-up it. It's mutual aid between our county, Onondaga, Cortland, Tompkins, Madison, and Oswego. It's a formality. We really have not needed to call on it, but there have been circumstances to the west of us, for example, when there were hepatitis A outbreaks and mass vaccinations needed to take place. It allows for personnel, health departments to help each other.
I guess my question is, I understand mutual aid fairly well through the fire department, so the health department work the same way. You know, if you send 3 people in a vehicle to Tompkins County, the mutual aid program covers those folks.
Yes, so it helps with the liability issues.
Right.
Yep, exactly. It helps who's going to pay their salaries. It
Right.
spells that out in the agreement. also.
Okay, that's
Yep.
my concern or question.
Any other questions, discussion? All in favor?
Aye.
Any opposed? Yes. Well, what did we hear from you, Jonathan?
Yep, I'm an aye.
Thank you.
Aye.
And one more HH3.
That's
Authorizing-
social,
I think
Yeah,
that's
that's
enough.
social
yeah, social
Oh.
services.
Yeah. I went late this month.
Kathleen's done. Thank you.
Thank you, Christine. You ready?
My glasses. No, my equipment.
How are you?
This is a good show. I was gonna say, you have the
Yeah.
share, don't worry.
Don't think on.
Want me to talk first?
Yes, if you can give us an update. We don't have a written report, so we'll look forward to what you bring to us.
So I prepared packet for everybody to talk a little bit. I thought it would be a good opportunity to talk about some of the information that I've been sharing with members of the public around the Department of Social Services responsibility to provide emergency housing. The folks that come to the Department of Social Services. Last Monday, I went to the Zoning Board of Appeals and gave part of the presentation to provide a picture of the department's obligations and to provide a little bit of information about what we're doing currently to serve folks that we're putting in emergency housing, how we're housing them, cost of that. And so I thought that it would be a good opportunity tonight just to talk a little bit and touch on some of these talking points that I had already gone over. So folks hear about that.
Is this the presentation you did for us at ZBA? Yeah. this
Yep. So the Department of Social Services is obligated under regulation of Office of Temporary and Disability Assistance through the state of New York to provide housing assistance temporary housing assistance and emergency housing assistance to eligible individuals and families. So within our department, I have a team of folks that are responsible for doing that eligibility determination. Screening folks that come in, asking them a whole lot of questions about their circumstances, their income, where they've been staying, if they have been renting an apartment, if they've been, staying with somebody that they know, just to get to the, really specific details about what their circumstances are. And if folks are eligible for emergency housing, we do a number of things. But before we even actually get to housing them, we try to advocate with landlords to see if we can have someone stay in an apartment that they're already renting. We do a lot of advocating. We do a lot of, finding solutions for folks to stay with friends and family. And we're very often successful at having a good outcome and having them not to actually go into an emergency housing with shelter or a hotel.
Christine,
So-
can I stop you for a quick second? When you mentioned, they come in, what are the other places and ways that you encounter somebody who is in need of emergency housing? So like, they're not, not always, they're not just coming in at 9 o'clock in the morning when everyone's here, right? So if you could talk a little bit about
Yeah.
that.
So during business hours, they typically present in the county office building. They come up to the third floor. Sometimes we get phone calls from folks and we tell them, where they would need to come to the third floor. After hours, and on the weekends, on holidays, folks, if they're in a circumstance where they are unsheltered and they're wanting the department's help in helping them find shelter, they connect to us through our answering service. We have a worker that's on call, on nights and weekends that's specifically there to screen for homeless, concerns. There's homeless folks that are out there that are looking for shelter. So that screening that we do during the day also happens during the holidays and on the weekends and after hours. Same kind of thing happens if it's after hours, same kind of conversations about, what is your income? Where have you been staying? Can we call, can you give us 3 people that you've, that in your life that we can try to advocate for you to stay with them, at least to get them through to the next business day when we can explore it a little bit further. Is that what you mean?
Yeah, and I was just curious, because I was brought to my attention a situation where APD at night and our police department had come across them they contacted you for the person, I think, or tried to get you to triage them, and they didn't meet the qualifications. And I knew somebody from the community was in a ride along at that time, and they were shocked. They were like, well, clearly this person is homeless, And I said, there is, it's a gate that you have to go through, and you have to meet the qualifications, and they didn't meet it. So this person had called a little outraged about the fact that, why couldn't you just do it?
Mhm. Yeah,
they
not
were
everybody
shocked
that
to know
comes
there
to the
was
door that says that they need housing is housed.
Right.
There's far more are turned away. Far more solutions are found for than we actually end up housing. And I do think that is sort of a perception that anybody that comes to the door is
Right.
housed. That's not the case. So, I think.
Can I ask a question? I can't. Can I ask a question?
Yeah.
While she goes, there used to be a face-to-face requirement on the weekend through Chapel House. That's no longer?
No, that's no longer.
They,
The Department of Social Services does the screening. So it's actually our eligibility folks that are through the department that actually do that screening.
on
On
call.
call after hours.
They
To
used
make that
to,
determination.
there used to be
We tried that and found that really wasn't the most successful.
our
So we-
staff and the
Yep, so we
county
went back to
staff to
having
do
it
it.
be DSS staff. It's
Yep.
definitely a more rigorous screening.
Yep.
Feel way more comfortable asking those questions.
Yep.
To try to determine if they are in fact eligible or not.
Yep, thanks.
So one of the other things that I touched on and want to say here too is that there is this sort of notion that we're taking in a lot of folks from the other communities that are surrounding our county, from other states. And I know I pretty much say this every meeting at the committee here, that we only have a couple of people that are actually folks that are not from Cayuga County that are being housed by us. I think last month I said that we had one family and one individual that were being housed. That pretty much holds true whenever I ask the staff up there, like how many people are not, Cayuga County, coming from Cayuga County. And even the folks that have lived somewhere else, we find that they're coming back here because they have a connection here. They've lived here as kids, they have parents here, they have, roots here, basically. So
Just a quick question on that. Do you have a list of counties that you have those metrics from? Because I know people just naturally think Onondaga County. Do you have metrics from Tompkins County, Monroe County? like
that
other
are
counties?
people coming here.
Yeah,
So we don't, like Tompkins County can't call us and say that they want us to shelter one of their folks that are, reside in their county and are eligible for services there and have them come here. That's not happening. We have enough to house here to fill up, the shelter beds that we have. So we're not, we're not taking in folks from other counties like that. I mean, if somebody is here from another county or comes here from another state and, we're not able to, determine that they have a place to stay somewhere else, that they are, like truly in need, they don't have any money, they came here, they, for some reason came here from North Carolina, like we are obligated to house.
well, that's
They
what,
meet the
that's what
criteria.
that's what I meant.
We don't
versus-
have a ton of them.
Okay, yeah, I didn't necessarily mean like, representatives from those counties calling you and saying, hey, can we make an arrangement to send our folks up to
Mhm.
Cayuga County? I meant the folks who may have lived in, let's say, Tompkins County and then became homeless and then they kind of navigated this way.
Mhm.
We are obligated, correct, to house them if they come here.
If
If they just wander in, they don't have money,
But
we need to
we,
house them.
those are the folks that we try to make sure that we do a good job with sending them back where they come from. I mean, we are successful in a lot of cases. There are some situations where that does happen, but it's not the majority or a large group of the folks that we're housing.
Thank you.
Question from legislator.
And I know
Daley.
there was discussion by the significance of being part of the continuum of care with these other
Mhm.
counties. And somehow the assumption was if we're part of this continuum that we share people that are homeless and
Yeah, so Megan Stewart talked a little bit about that and,
Uh-huh.
and provided some information about that to, at the zoning board of appeals. And, basically what it is there's a prioritization. And the first prioritization level is that, it's the folks that are from our county need to be housed by us first. And what Megan had said to me was, there isn't, you don't have open shelter beds for other folks. So there are openings for these other people to come to. If we had some sort of a gap, then, that may come into play, but we don't. We don't have a gap.
we had empty shelter beds and we could consider taking from a contiguous county. Is that what you mean?
Basically, I mean, she said that it's kind of complicated. I mean, there's
Uh-huh.
different prioritizations of people that are, chronically homeless, have certain disabilities, like
Uh-huh.
those are some of the priorities too, but, unless, if we are not meeting the shelter needs, for our folks here, like we're not getting to those other levels.
But how does that work though then? I understand you're saying that we meet the shelter needs of our own people here in the county. But if we're mandated to house other people that are coming from other counties, other areas, so how does that work? If we're mandated, we have to provide them with housing. So how does that work if we don't have enough beds? What does that look like?
So what it typically looks like is we find out that someone has benefits somewhere else. So if someone has temporary assistance benefits from somewhere else, they're renting an apartment somewhere else, they don't get housed here, they go back to where they were. We send them on a bus back to where they were. I mean, that's
But what if they don't?
if they don't,
Like, what if that doesn't happen? Like, what does that scenario look like? If you can't send them back or you can't find a family member, then what happens? If we don't have any beds, how does that work? Being that
Homeless, then in the street.
then they're in the street. We have no place for them to go at the end of the day anyway.
so if somebody
Right.
decided they wanted to come here from Texas and just picked on a map that they wanted to come to Cayuga County, I mean, we would go through all of that screening around, why are you here? What do you have here? What are your resources elsewhere? And, ultimately in the end, if we're not able to advocate for them to go back somewhere else, then yeah, we would have to meet their needs. But I think the point I'm trying to make is that people think that that's a large number of the folks that we're serving, and it is not. It is not a large number of the folks that we're serving. Most of the folks that we are providing, the great majority of the folks that we're providing housing for are Cayuga County residents. They've lived here for a long time. They grew up here.
And given the beds that we have available,
Sorry if I missed it.
Jonathan,
Oh, something.
I'll continue while he's frozen. Given the beds that we have available here and the numbers that you have given us over time, we wouldn't be able to shelter anybody in any other county.
Right.
Anyway, it's just,
Right, but that's
It's an
what I'm
impossibility.
trying to get at. If that's an impossibility.
Can you
mandate
hear me now? I'm sorry.
Those people,
They're being housed
they're
by us.
just, well, they're gonna be homeless in our county.
They're gonna be homeless in our county. We're gonna
Is-
meet their needs if we're not able to advocate for them in some other way, or, get them back to where they need to go, or, give them a bus ticket to go back where they go. We don't leave them out on the streets. Is that what you mean? Is that what you're asking
Yeah,
me?
like-
Well, if all our beds are full,
Well, we don't have very many shelter beds, so like, I was gonna get to that too, like what we actually have for shelter beds right now is not very many. How we're meeting needs is through hotels.
well, that leads me to my question. I know we rent rooms from the hotel. Is that an infinite number? Or does the hotel say, look, we'll give you 10 rooms, after that, you're out of luck?
Depends on the hotel.
Well, I'm just saying, is the number of hotel rooms available, is that an infinite number regardless of what hotel it is? And the reason I was right to Stephanie's point, if this person decides, well, I'm not leaving and I'm standing in the street, now you have to take care of me. Okay, call up Hotel A and say, do you got a bed or a room? And if they say no, then, Hotel B's next on the list. Eventually, we're gonna find a place to put them. So that number technically is infinite.
Or if we don't find a place to put them and we provide them with food, we may not necessarily be providing
Well,
with
what's the
shelter and they
obligation?
remind.
To me,
They're out on the
the way I
street.
understand the obligation is, we have to house them.
If they're coming here and
That's
they're
what I
asking for
understand.
the department to provide temporary housing for their emergency situation and they're eligible, then we are obligated to house them. It's not whether they're worthy, of our services. It's whether they're
Right,
eligible
right,
for our
right.
services. So we are an arm of the state, regulations, and so we are providing shelter for the folks that are eligible under the New York State regulations. This is not us deciding if someone is worthy enough to receive our services or, is, in our minds, shouldn't be seeking our services. It's about eligibility.
Well, then, I guess, this leads me to my next question, and I don't mean to drag this on or beat a dead horse, but, is there an exit strategy for these people? And when I say that, I mean, okay, we're gonna put you in a hotel. How long can we put them in a hotel?
So some of them they're in hotels until they can find permanent housing or get into permanent supportive housing. If they get employed and don't meet the criteria anymore for the department to be providing them with services. So while someone is being provided, housing by the department, they are working on an independent living plan. They are working towards, upping their employment to be at a level where they're going to be able to be sustaining their own shelter by themselves. Some of them are getting, connected to services that they need for social security, disability insurance, things like that, to get on SSI, SSD. When they get to that level of income, hopefully they'll be able to go off into their own permanent housing that they find themselves or that we help them find. So the purpose is not to provide housing to them forever. That being said, right now there is a huge problem with housing for very low income individuals. Not just in our county, but all over the
Yep.
place. The rent prices have gone up astronomically. The amount of money that folks are, coming to the table with that they're earning or that they're getting for benefits is not enough for them to be able to secure an apartment. So they're staying in emergency housing far longer than we would like them to, far longer than they ever have. So that is why the local cost for Cayuga County for sheltering the folks that we're talking about has gone up, gone way up.
Yeah.
And the number of people that we're providing the assistance to has gone way up. And a couple of months ago, one of you asked me like, where do I think that's coming from? Maybe it was you. And we talked about like some of that around the challenges with, the mental health crisis, for adults, children, for families to navigate. But it's substance use, has gone up. And those are not, drivers of, homelessness, but they are intertwined for sure. They do intertwine.
Well, what you just said about the affordability, I mean, that is true nationwide. I mean, I was just hearing something on the news the other day. They were
Yeah.
talking exactly that.
I don't-
Housing versus the
So if we could
salary.
move people out quicker, we would be able to have less numbers. But we have seen over the last couple of years that it's very, very hard and challenging for individuals and for families, honestly, to find affordable, apartments, homes to rent.
I think your staff, you all work hard and I think you're doing the best that you can. I guess my concern is, and what I see, and I can be very wrong, but I believe that there's not enough of an exit strategy to get these people out of emergency housing. And I use the word emergency. And it just seems to me that, it's like, okay, we help you get, a mediocre job. You're not making barely minimum wage and, you're on subsistence and it's still not enough to provide them with a means to support themselves with a house or an apartment or whatever. So it's a vicious cycle. I don't know, it's probably not enough, but the bottom line is the taxpayers of this county and the state are beholden to this issue. And I don't have the answer, and I know you don't. I'm not pressing you for one, but the bottom line is it's just, to me, it's a never ending cycle. These people just go from place to place, and some of them, it doesn't take long if you stand down out front. You see these people, they don't want to be helped. They want to be a pain in the butt. And, they want to live in the hotel and, they don't want to go out and get a job and be, supportive of themselves. So.
I think,
One of the things I want to remind people is that this legislature has put $1 million aside for a housing shelter, a large housing shelter, through the partnership of, which is it, Housing Visions, which has done this in 3 almost contingent counties. What their program includes is that really what you're talking about, intensive case management for that exit strategy, that we're missing in the hotels and the shelters now. That's why you were at the zoning board of appeals. We're working desperately to find a place for, they've received the grants. We've put in our commitment and we are having trouble, we've been shot down twice on potential places to build this kind of shelter that would include all of this programmatic initiatives, including things like day rooms for places for them to stay, so you don't see the hanging out and around. They'll actually have a social day room to be pro-social in. Meals that are only provided for them, so you don't have, general public coming in. But intensive case management programs wrapped into this, and it's a remarkable. The study that was presented to us by Chris Tremonti shows the remarkable reduction in that county pay, that county cost. But we're still searching.
So what I'll say to that though, I agree with you. I mean, we need all those things for sure. However, I do agree with you, Mark, that we can have all the programs that we want to have and we can subsidize all these programs and give everything we possibly can to help. But if the individual does not want to be part of those programs and does not want to get the help, they're going to remain on the street and we're going to not solve the problem. It's voluntary. I've had many conversations with law enforcement and they are provided with everything they could possibly be provided with, and they just don't want to go. We don't want to follow the rules. We don't want to, we're happy being the way we are.
are you talking about unsheltered individuals?
Yes.
Or you're talking about unsheltered?
Unsheltered.
So
They,
That
there's a
doesn't
lot that
count
choose
any
that.
burden that's there. for
Right, but it's
lives
not
and-
gonna solve the homeless situation that we have, that we're talking about at the end of the day. I mean, there is that component to it. That's not gonna solve that portion.
Most folks that are unsheltered, not just in our county, but are very challenged by serious issues around, substance use, mental health disorders. You know, the PTSD, I mean, like some significant things that get in their way of taking advantage of some of those supports that you're talking about. The people that I'm really talking about here are the folks that are coming to us, who are seeking emergency housing, who are eligible for emergency housing, and what we're doing for them and how we're meeting their needs for sheltering them, essentially. And I just want to make sure, like, I talk every month about how many people we have that are being provided emergency housing. At the end of last month, it was 100 individuals and 37 families. So the places that we put those 100 individuals and 37 families are, I put this in the packet to just kind of give you a little snapshot, and this is what I talked about at the presentations. We only have the Chapel House, current Chapel House on, at 292 Grand Ave, that has the Rambley Emergency Shelter, a 16-bed capacity. And we have the Franklin Street Men's Shelter that's up to 15 beds. We don't ever have 15 of their beds because they have a contract with the VA. The VA takes some of those beds. So we have up to 15. So, technically the max would be 31. We're never at that max of 31. And then we have 8 families that we can have in the Family Transitions Program, which is a short-term transitional program for families that are in emergency housing, and then intensive services put in for those 3 months to try to get them to a place of being in permanent housing. Same thing with the shelter folks. There's supervision, there's case management. When we have the rest of this group placed in a hotel room, they have a hotel room. They're very vulnerable in the hotel rooms. There's a lot that happens in the hotel rooms that's not good. You've heard me talk about that too. People that are very vulnerable are often preyed upon in the hotel rooms. We have, people that are, kind of able to just sort of seclude themselves and not take advantage of different services. They're not, being seen by the shelter staff, and encouraged to, engage in those treatment services. So it's not an ideal way to provide shelter to families and to children, families, and to adults. And it's what we're mostly using to provide shelter to folks in Cayuga County right now.
Do you have a rough number of how many rooms out of all the hotels that are utilized for shelter?
How many rooms on a night are
Yeah,
hotel rooms?
like how many hotels are you
We're
utilizing right
we're
now?
using 8 hotels.
Okay, and then how many rooms would you say combined out of those 8 hotels
Well,
are
I
utilizing
mean,
for?
so you can kind of figure it out from the fact that we only have 31 shelter beds available.
With 8 hotels.
And so it's a lot. I mean, we're utilizing
At $100 a day
at about an average of 100, about averages out to about $100 a day.
per room.
Per room.
Yep.
Yeah. And, it's just not ideal. And, I talked about this, you've heard me talk about this, that there's just no supportive services. Very challenging for folks that are struggling, to be housed in that way. And, the reason, that, we're talking about the potential for a larger shelter is to meet the needs of these individuals. And what that.
Pull them out of them.
Have them come out of the hotels, not utilize the hotels. We still would need to utilize hotels for families. Because we're talking about if there were a shelter rebuilt, if there was, approvals, to get there, it would be for the single individuals.
I
Just-
apologize, I should have flipped the page, it's right here.
Yeah, that's
Just to be clear, like when we have a fire at somebody's house burns down and it's not livable, Red Cross is notified. Now, that's not the emergency people that we're talking about. Red Cross and your folks are completely
that's a
separate as
different-
far as, I just want to make sure that that's understood. Right.
Sometimes those would end up coming to the department for help too, if they don't have income. I mean, they may need other assistance during that time, but not by and large.
Jonathan has his hands up.
Yeah, I have a question. Actually, it's a 2-part question. The first part is how many are we currently servicing for families or individuals, the total? And the second question is you talked about giving them assistance and moving them off of it. What's the average time that we are housing people for?
So the first part of your question, right, like on a daily basis, the day that I put this packet together, it was 100 individuals, 37 families. And right around this time of the year, that's been going up a little bit on the individuals and down a little on the families, but pretty much staying right around there, 100 individuals, 37 families. I can leave a packet for you, Legislator Anna, that you can have that talks about, I think I gave this graph out a couple of months ago that talked about where we were with housing adults and children over the last 4 years, 2021, 22, and 23. That gives a total number of adults that we provided emergency shelter to is 455 last year and 175 children. So that was the total number for the year. But on any given day, it's been about 100 individuals and 35 or so families.
Okay,
Does that answer that?
it does. Thank
This
you.
is unduplicated, Ken.
Yep. Unduplicated count. The second question was, remind me again.
It's just how long the average time frame from the time they come in, say intake, and you house them to the time that we're able to find them housing or relocate them out of housing assistance.
So it varies. I think we have some people that are in for a couple of days, and then they're out. We have some that have been in for, over a year. And it depends on their circumstances. It depends on their income, depends on their employability.
And there's no cap on how long they could stay. Is that correct?
Well, as long as they are complying with their plan with us, their individual living plan, and abiding by what we're asking them to do by regulation. I mean, they can continue to stay until they find permanent housing. They are providing us with their housing search every single week. They come up, they meet with their worker, they're meeting face to face with the worker to show us that they're searching. We have case management that's involved. Managers that are giving them information about different programs, subsidized housing, all of those things to try to help them move forward. But again, it goes back to what I said at the beginning, the lack of affordable housing drives the long stayers for staying so long, because there just isn't places that they are able to locate and to rent within their budget. I know I've taken up a lot of time, but
That's all right.
yeah, this is so you can take this, look at this. If you have any questions, you can certainly let me know. I'll end my little report out on just a couple of big numbers that I think are important to highlight. Our hotel expenditures last year, with the knowledge that I'll say caveat, with the knowledge that I was able to, the information I have available to me right now, the expenses for hotels in 2023 was $2.567 million. That's what we paid the various hotels. Our local share after reimbursements is 1.3 million. That amount is pretty much totally for the single individuals. We get far better, 100% reimbursement for families, and for some other eligibility categories that we are able to access that are reimbursed 100%. The single individuals are a safety net reimbursement of only 29%. So they're very costly for us to house single individuals.
And families, TANF, what is that? Reimbursed, that's 100%.
Reimbursed at 100%.
Individuals are 29, right?
Yep.
State, not federal, right? No federal, just state.
Right.
Yep.
Yeah. And then this is not talking about the hotels, but talking about our shelters that we utilize through Chapel House. In 2023. Let me get the total. The cost for placing the single folks in the shelters that we have available through Chapel House was right around $634,000. And we received reimbursement on that brought it down to a local share of about $450,000. So those two together is about 1.75 million local share. So it's a lot of money that we're spending to provide these services to the folks that are eligible, folks that are here, the folks that are already here. These folks are already here. They're here in our community. You know, they, like I said, the vast majority of them are from here. They live here. And they're struggling with, you know, being able to find affordable housing. So I'm happy to talk to anyone that has any questions or wants to dig deeper in this after you look this over. It's a lot. But I think it's important to get the information on the table. No, Jonathan wants to. I think I'll leave it at that.
All right,
Yes.
Thank you.
I report out.
all right.
You can sign given this presentation. Not really.
Two resolutions?
I only have two
We have two
resolutions.
resolutions. HH3, authorizing the chair of the legislature and the commissioner of social services enter into contract with the Washington Community Center. This is around providing day camp registrations to Hannah.
Make a motion.
Second.
So, this is for TANF eligible families, so this is 100% reimbursed. We're asking for, to be able to contract with them for $15,000 to provide, summer camp services. They've done this for us for a while. They provide, a large number of children in the community, great experience over the summer with going to day camp.
Move it, Mark. Or do we do all
Yeah,
that?
yeah,
Done.
I did. So any discussion?
No,
questions?
sorry.
I have one question. I just wonder how, on average, how many children the $15,000 does provide scholarship for? You may not know off the top of your
I
head.
don't, but I can get that information to you. I don't want to take a guess and have it be wrong, so I'll let you know.
It's a renowned, well-run program. Remarkable activities. Remarkable, I've attended and watched and in awe of what the staff and children do there. All in favor?
Hi.
Any opposed? Saw that thumbs up, Jonathan? Okay. HH4, authorizing the Commissioner of Social Services to fill a part-time case worker position in the Child Welfare Services Unit.
Not a part-time, it's full-time.
I'm sorry, full-time.
Make a motion.
I'll second for discussion.
So right now we have, with this bill that I'm asking for, the board to consider, we would have 3 openings of, caseworkers, then DSS.
Are these currently budgeted?
Yes, they're currently budgeted. They are budgeted positions.
With 62% state federal funding.
Correct.
This is a current vacancy, correct?
Yes. Yeah, we have 3 vacancies right now. 2 that we've already received permission to fill, and this one that I'm asking for permission to fill. Yes, and they're all in the budget.
We have-
Budget.
Do we have people in the week? Or is this like a bad search that we have?
No, I mean, the casework positions, we have had a number of openings. I, feel like I come in here every month and ask for permission to fill a caseworker position because of different transitions with people who are leaving to take other jobs. Some leaving to go to other departments. But we by and large do have success in filling these positions.
Good.
It's a continuous recruitment. So if someone's interested in applying for the position, they're able to come in and take the civil service test very quickly. So we're able to kind of catch them when they're interested, bring them in, get that test taken and then bring them in for an interview. So pretty high success with finding folks. It's keeping them. That's keeping them here. That's what more of the challenge is.
And means child welfare service caseworkers aren't, this particular position is not eligible for help at this point.
Because we have
ATLP
continuous
program.
recruitment, it is not eligible for help.
Any other questions, discussions? Hearing none, all in favor?
Aye.
Opposed? Carried.
Thank you for your time.
Thank you for your time.
Brenda. I skipped over Lauren, so I'll get to you. Sorry about that. You're very patient. Hello.
So I just had a couple updates on my report and certainly open to any questions that you might have. I had indicated that we were getting funding for the Go Grandparent. We did have the portal training today. So we should be able to launch that program by the end of the month. And you know, it's all new to us, so we're very happy to have an option to get people for travel. And we will not know how well it's gonna work until we try it. So that's kind of where we're at with that. And we'll be putting out information in our newsletter and on the website and on Facebook and a press release once we're ready to actually start registering people for that program.
I love the name of that.
What's that?
I love the name of it.
I know, right? It's unique. And so then also, we are very happy to have all of our positions filled except one part-time food service helper. It's been about 18 months. We've been short-staffed, so this is a huge thing. It's amazing how much better an organization can function when all your positions are filled. It's great. I want to update, this is our third year of doing the rural outreach in Moravia and Sterling. And Moravia, we had a small turnout of about 8 people. And the USDA joined us to promote the options they have for assistance with rural housing. And then we have an outreach in Sterling planned for Friday. We already have 7 people signed up for that. The USDA will be coming again. And the Veteran Service Agency has asked to also attend with us. So it's growing and we're glad to be able to coordinate and get these programs out to those areas. And actually are very grateful for the Moravia Town Hall and for Sterling for hosting that. It is important that we have, it's not really just a fair, we're meeting with people individually to go over their questions. And so sometimes that's some confidential information. And these places are providing us with some spots where we can start those conversations. And then the senior fair, I wanted to make sure I had mentioned that it was on everybody's calendar because it's one of our biggest events of the year, September 25th. But the other piece that I wanted to, it made me kind of segue into is I wanted to thank the Sheriff's Department and Brian for the press release related to scams in the community. It is, you know, an ongoing issue, an ongoing concern. I think it impacts our older adults the hardest. And, you know, our Sheriff's Department has been really good and APD have been very good about responding to those concerns and sharing community information. With Brian's input, we're going to share his information provided on Facebook and our newsletter and such. We do have an article in our newsletter, typically at least 3 times a year on scams. We'll also be covering it. There's a whole day workshop. Half of the day is about scams that our senior council, which is a separate organization of seniors in the community who are sponsoring a program on June 14th here in Auburn. And scams will be for a half day of that program. And then when we do our senior fair, we also have somebody coming out to talk about scams is our plan. So I just wanted to update that from what we already had on the report. Do you have anything else?
Any questions on the report? Okay. We'll move to HH7. It's authorizing the renewal of the lease agreement between PFI Housing Company of Auburn, Inc. and the Cayuga County Office of Aging for a portion of the premises located at 149 Genesee Street, Auburn, known as Boyle Center, for the space formerly known as the long-term care office. This is essentially renewal.
Second.
Just move
I'll second.
Any discussion? So, hearing none, all in favor?
Aye.
Any opposed? Carried, thank you.
Thank you.
All right, Lauren.
Hello.
We didn't receive reports, so we're looking forward to updates.
No, I do have a couple updates. I know last month we talked about the number of people that were going from jail for restoration. We do have one less one. So I just wanted to let you guys know that she's still being hospitalized, but it's not the county's responsibility to pay for that due to her 7:30 order expiring. So I just wanted to let you know.
Good news.
Still having trouble as far as hiring social workers. We did have a couple interviews, which is more than what we've had in a while. We did offer the job to one of those people, but they took another job opportunity, turned down, our position. And then there's another one that might be interested in part-time work. So we don't have any part-time positions open, but that doesn't mean that we couldn't change one to a part-time position, just to be able to get somebody in there. So that could potentially be coming depending on how interested she is in that position. A little bit more than what we've had, but not.
Out of curiosity, when they turned down the position, did they give you any special reasons why?
In this situation, the person already works for another agency that was able to provide them a better kind of package as far as wanting them to stay there and then offering more money.
In your mind, why do you think it's so hard to attract people into that position? Because of the type of work that it is? Or what's the reasoning in your mind?
I think that more so now than ever, social workers are working from home and doing a lot of private practice work, virtual work, and able to make probably more money and have a more flexible
It's a
schedule.
combination.
I think it's a little bit of, it's a complicated answer.
No, it's enough. So it was kind
And
of,
make it very easy and attractive for people to work from home now, as opposed to what it
Yeah.
used to be. So,
and then you throw more money in the mix, then it's a no-brainer, right?
yeah, and we try to, offer some flexibilities as far as working from home when we can, but I think sometimes people just want to do that full time. So. Yeah. And I know I talked to Heidi about Monica coming to the May meeting to talk about do a little presentation on overdose trends and Narcan trends in the county. So I believe that is going to be going for May's meeting. So I just wanted to let you guys know.
So you have two resolutions, HH5, HH6. HH5, authorizing the filling of a full-time staff social worker position at the community mental health center.
Make a motion.
I'll second discussion.
Questions, discussion?
This is just the amount of time has lapsed since the last resolution. We weren't able to fill it, but that's why we're doing the resolution.
So it's a budgeted position, we just can't fill it.
Right, so we expired the last fill.
Yep.
Yep. Any other questions, discussions? All in favor?
Aye.
Any opposed? Carried. HH6, authorizing the legislature to create two budgeted staff social worker CMH help positions at the community mental health center.
Cool.
Thank you. Let's for the discussion, questions?
Again, same question, just you can't fill it.
So this is a program with the state that will allow social workers to not need to take a civil service exam. So it's recognized as a position that qualifies for that. So this is just unfunding two social work positions and funding staff social workers CMH help, because that does need to be in the title in order for them to not have to take the civil service exam.
This is just what we did.
So it's temporary and they would go back into their other positions once this program sort of ends, is my understanding.
Well, what's the sum, this program?
I believe at the end of this year, but they also changed it before and extended it, so it could be extended, I'm not sure. So I have to come back to do a resolution for them to be put back into their staff social worker positions once the health program is over.
Jonathan, did you have a question?
Yeah, I was just gonna say, this is the exact same thing we've done the last couple of months by moving positions over and funding the other just to avoid a civil service, and then we backfill it later into the civil service position. Is that correct?
Yes, it's been done in the DSS department.
Right. And then we'll get away, then when we move it back over like we did in DSS, we'll just get rid of the positions we're creating today. We'll go away and then we'll put in the service spot.
Yes,
And there won't be any change in pay status, correct?
correct.
It'll all just, it's
It's
just
just the
even out
interim wash.
straight across,
Yeah.
just a wash. Very
Yep.
good.
And then at some point, we'll be talking about abolishing these positions because the health
Program is no
program
longer.
is
Very
no
good.
longer existed. So. Any other questions, discussions? All in favor? Any opposed? Carried. Thank you. Thank you. And we will hear from Deborah. Hello. Is your husband busy?
I just wanted to start out by just following, just giving you a follow-up report on the AED situation. I reached out to Kathleen Cuddy in the health department and she, their department gave me a great resource that I've been able to share with a lot of my communities. I know Weed Sport specifically purchased 2 from the contact already, so they're on their way to purchasing the safety equipment they need for the sports requirements for a lot of the programs. So thank you for her help with that.
And as I understand it, they're at a much reduced cost.
Much reduced cost, yep. They were able to give us some contract pricing on that as well. It did go up a little bit from the quote I told you last week because they have to have the pediatric component of it as well. It's not what was originally quoted, so that does increase the cost slightly, but it's still less expensive than it was when they were just going after it on their own. As Heidi had mentioned, she is part of my youth advisory board, so she knows that we've been busy. We actually had a great meeting last week with the board. We went through, we were able to get through 10 of 15 of our program applications, just because of some time restraints and being able to maintain quorum. We had to postpone the rest of the voting until tomorrow night. We're doing a quick Zoom call to vote on the last 5 programs that we're going to be looking at for 2024. So that's tomorrow night at 6. And that's all I have now on the programs that we voted on last week. I do have them tonight for resolution to go over.
Is there any questions? Begin to review those, starting with HH8. HH8 authorizing the chair of the Cayuga County Legislature and director of the Youth Bureau to enter into a contract with Cayuga County Employment and Training using ARPA funds.
Correct. This is the,
Motion.
oh, I'm sorry.
Motion it to put it on the table for discussion.
Move it. I can.
This was the program that we've spoken about the past couple of meetings regarding the STEM program they're doing with the 8th grade students in the Cayuga County School Districts.
And that's the money that we gave you from.
From ARPA, yep.
So it'll be countywide. All the schools.
It'll be countywide for all the school districts in Cayuga County. Cayuga County students who go to school outside of the county, unfortunately, those schools can't be tended to, but they'll be given the information on the program if they want it incorporated into their school. They'll also be invited to the evening that we do it at the employment and training.
Any questions, discussion? Hearing none, all in favor?
Aye.
Any opposed? Carried. HH9, authorize the chair of the Cayuga County Legislature and the director of the Youth Bureau to enter into a contract agreement with the Cayuga Museum of History and Art using ARPA funds.
Second.
Thank you.
This is a new program that the Cayuga Museum of History and Art is looking to pilot here in Cayuga County, so they're able to go out into the county. They currently provide STEAM field trips, programming to all students at Genesee Elementary School. But right now they're wanting to go out into the rural areas that they currently don't have access to the museum here in Auburn. It would focus on K through 6. It would be a summer program. And with the funding, they would be able to have a startup of supplies and everything to maintain this for school field trips as well. They already have agreements with several smaller libraries, such as the Hazard Library and the Village of Fairhaven Public Library. There's no fee to participate in this. Like I said, the preliminary funding for the year would secure supplies and equipment necessary to continue the program beyond the 2024 season.
Any questions, any discussion? Excellent program, excellent outreach. Around the county. Hearing none, all in favor? Any opposed? That was a thumbs up, Jonathan. Okay. Carried. HH10 authorizes the chair of the Cayuga County Legislature and the director of the Youth Bureau to enter into an agreement with Combat Recovery for a youth martial arts program using ARPA funds.
Second.
The Combat Recovery Program is located in the basement of the,
Try.
yes, Next Rides for Fun building over on Chapel Street. There's a, they're looking to pilot a youth martial art program called THREAD, which stands for Teamwork, Honesty, Respect, Empathy, Awareness, and Discipline. One of our youth advisory board members is actually a member of this program. I've gone to visit the facility and they have a lot of great ideas that they're looking to do, focusing on youth ages 6 to 11, to have classes during the week as well as do programming during school breaks in the summer. This program would provide workshops and also the instructors and scholarships and equipment that they would need to put this program on, as well as some promotional advertising dollars to promote this program. There's already an adult program that's taking place there, like a kickback MMA type program. So I just wanted to expand this to the youth and working with a lot of referrals as well in the Cayuga County Jail with a lot of incarcerated children of incarcerated parents as well.
And that adult director, Randy, will he have a plan this as director or manage the?
Yeah, right now it's him. He would be the program manager for this. And we've done a similar program in Cortland as well.
It's a real asset, excellent work. Been down there to watch him work with. He's already working with young people.
Yeah, they're welcome to join the classes as well that are going on now.
Any discussion, any questions? This is, really unusual in a positive way in that it really combines the emotional, the social, and the physical aspects of youth development. Hearing no other discussion or question, all in favor?
Aye.
Opposed? Okay. And finally,
Oh, yeah.
authorizing the chair of the Cayuga County Legislature and the director of the Youth Bureau to execute agreements with various agencies to provide youth development services. CFS funding. We have a motion.
This is specifically for the OCFS funding we get from New York State. There's specific funding streamings for this. So the first one is for Auburn Ice Hawks, and that's for equipment. And that's going to be putting together a station for children to go and practice their skills on the ice. It's a practice shooting area with nets, pucks, extra sticks, and ice tiles that can be used by children and families during high school games. And it'll be open as well down at Casey Park during open skate, and there's no cost to use that equipment. The second one is for the Auburn Stingrays. It's a swim team here based out of the Auburn YMCA. The children of that program do a lot in the community as well, helping with food pantries, pumpkins for Westminster residents, and gift giving at the holidays. There's swimmers from a variety of school districts, not just Auburn. A lot of these swimmers also go on to become lifeguards and swim lesson instructors, and they're looking to use this funding for scholarships. Individuals who are a Stingray have to be a member of the Y, and then they pay a tuition on top of that to be a member of the program. So they're asking for the $4,000 to help cover the cost of those who are not able to pay in full or partial. The next is the City of Auburn Recreation Swim Program. The YMCA is going to be doing lessons at Casey Park for 6 weeks during the city summer recreation program. So the funding they're looking for is just to cover the cost of their swim lesson instructors and their lifeguards. Oh, the Northern Cayuga Little League, that comprises of Weedsport, Jordan Albridge, and Port Byron, their Little League programs. Primarily for scholarships, equipment, if children need it who are not able to afford it, as well as AEDs. I know Weedsport specifically has already purchased 2 of the AEDs needed for the season. Southern Cayuga Little League, it's the same thing. Before, we had given some funding to South Cayuga Little League, so that was the Union Springs Little League program. So this is specifically for Southern Cayuga. They need 5 AEDs, and this would be to help them pay for 2 of them, or 3. 2 to 3 AEDs that $4,500 would cover. And the last program is a Seymour Public Library, looking for expanding their current youth program. Right now, their youth program, they get approximately 8,000 participants a year for 8 to 12-year-olds. And that's going to be expanding programs such as a family book club, a youth book club, book to movie club, an after-school STEAM program, and a Pokemon club.
Any discussion, questions? This is OCFS money, not the ARPA monies. Hearing none, all in favor? A question,
It's okay. That's all right. I saw it.
Jonathan, please, go ahead.
My question is just about the AEDs. I know we talked about this last time, and I know we're using funding today to purchase them, but who's going to be responsible for the training and the update? Because these things need to be, maintained as well. So is that the county's on the hook for that? Or is that going to be like the individuals?
No, the individual Little League, they have to implement a safety plan that actually has to go to the state health department. So I'm not sure the specifics of that. I know the Little Leagues in the area have been doing, the past couple of weekends, they've been doing training. I know they've done a group at the Senate Fire Department on Franklin Street Road, and they're doing another one this weekend as well. So I just kind of was the resource to kind of help them with some pricing, but we don't have, Cayuga County doesn't have anything to do with the AED responsibility. That's between the Little Leagues and the state health department.
Thank you.
Good question. Okay, any other questions, discussions like that? From the audience?
Just a quick question. Do you know the balance of the ARPA funds?
Yes, if these are approved, we have. Before these were voted on this evening, we had, this will bring us down to, if these are all approved, this would bring us down to 115,000.
Okay. And the goal is to get that appropriated by the end of the year with the board. Do you have a proposal from the Gaver Center?
For the Dolly Parton Imagine Library, I do, and I'm going to forward that to the board for us to look at for tomorrow. Tomorrow we have 5 projects to look over. The board is familiar with all the projects. We just haven't had a chance to go through all of them.
That's one of them. That was my only
And that will be one of them, yeah. So all the ones that we're going to be talking about tomorrow evening in our brief Zoom are all ARPA funding requests.
So will that bring you down to a 0 bottom line?
Mm-mm.
So, but you said earlier that this was all the applications for 2024.
That we have so far. I know we're going to go out because these are all the applications that we've received so far. There's still some other programs out there, and it would also depend on some of the programs that have asked for high amounts we're talking about tomorrow. We don't necessarily know if the board is going to agree to fund those in their entirety or spread the funding out over 3 years. I know that was a suggestion that we had for a couple
We
of
have
the
to have our
programs.
money spent or like allocated by
End of the
2026.
End of the year.
And that's spent.
Spent by
2026.
but allocated by the end of this year. Okay. Thank you.
I have 2 quick things. So I'm going to be on your board. So when are the meetings?
We do them quarterly. So the next meeting, we don't have a date for it yet, but it would be in June.
Okay, and can you send me all that information? Just so that I can kind of get up to
Yeah, of
speed
course.
with everything that's gone on.
Okay.
Thank you.
Is there a Zoom meeting tomorrow?
Okay.
Yeah, we're doing a
Send-
Zoom meeting tomorrow at 6 o'clock, and I'd be happy to share that link with anybody who would be interested. I know we're going to have a couple of the programs. We're going to give a brief 5-minute presentation and be available to answer any questions, because some questions did come up in our meeting last week to kind of clarify some of the aspects of their programming. But I'd be happy to share that link. Anybody's welcome to
Yeah,
join
that'd be
that
great if you
meeting.
could share that with me.
We'll get back to, it's been moved, any other questions, discussions? Hearing none. All in favor?
Aye.
Opposed? So, a motion for adjournment.
Make a motion.
Second.
All in favor?
Aye.
Aye. Thank you very much to all our committee members and our department heads.
Thank you.
Oh, you mentioned somebody.
Cancel movie night. I cancel movie night.
Okay.
I don't know what the weather's gonna do.
Tell, I don't know if you can hear me. No, oh, you can. Tell Tom not to get too comfortable. I'm coming back.
All right. He said Jonathan who?
Yeah, exactly.
Where'd our fearless leader go to?
Yeah.
Kentucky, or Tennessee, whatever.
Not making it back from Tennessee, are you?
Well, right now I'm in Florida. I was in Tennessee for Easter. I'm at my parents' house at the Villages just north of Orlando, and I'll be back in Tennessee this weekend and then home on Sunday night in time for the eclipse. So.
All right.
Great. Joy.
All right. With that, I guess we'll call the meeting to order. We have Legislator Daley, Legislator Shea, Legislator DeVito, Legislator Anna by Skype, and myself, Legislator Winslow. First order of business is we're looking to approve the minutes from our March 6th meeting.
I move it.
No second.
Second, any discussion? Hearing none, all in favor?
Aye.
Any opposed? Carried. And appointments to be made, there are none. And we'll just right into our department heads and updates. And first up, we'll call Denise Spangler for 911.
Good evening.
It's a nice chair.
Yeah, well, better.
Right? Go all the way down. Good evening. I don't have a lot, but there's a couple of things I do kind of want to touch on. We talked a little bit last month about our meeting with Motorola. Their initial response to our contract came back with like I don't know, it was about a 35% increase, which I wasn't interested in. So they went back to the drawing board and we met as a consortium last Thursday. And our increase is looking at roughly about 21%, which isn't terrible considering there are a few things that weren't under contract that are going to go into the new contract. And that's just a result of our contract being negotiated 6 years ago, because it was a 5-year contract. There's a couple of things that have been put in place since then, and they never added those. There was never an additional maintenance cost added during that time. So those kind of things will come onto our contract now. One of them being our redundant prime and that's located in our backup center. There's a lot of infrastructure there that wasn't, they were covering it, but we essentially weren't paying for it because our contract was already in place.
Are you with other counties on this?
So, we
Yeah.
kind of do a large scale contract with Onondaga, Oswego, Madison, Jefferson, and Cayuga. And we also all pay into the master site, which saves us a lot of money. That's actually gone down it started out, back in 2011, I think it was around 80,000 a year, and we're down to like, 45 now. So with all the additional counties coming on, it drops the cost of that. So that's been very helpful. But the other thing I'm looking at is moving our microwave contract to time and materials, because we really don't spend a lot of time and effort on the microwave. With our grant money, we've kind of been slowly replacing our microwave links. And we have a lot of infrastructure in storage. So if parts, pieces of parts go wrong, Motorola goes and fixes them, and we already have some stuff on site. So that'll actually drop the contract a little bit more if we move to time and materials. And I think that will be beneficial for us to do. Just looking at the big picture, because I'm trying to look at, the amount of calls that we have for microwave issues, and they're very minimal. So to spend $60,000 a year for a maybe, I'm thinking that it's probably a better idea to just go to time and materials for that. And then, we'll budget a small amount for the microwave repairs if needed. So I expect to have a contract sometime probably in May. We did ask them to kind of expedite that because I know we start working on budget early. And you're gonna want to look at it and, maybe have questions. So there might be a little bit of back and forth there.
Is there grant money for this?
Yeah, our seat grant generally covers that. Yeah, yeah. And that's been the other thing that I've kind of pushed to Motorola is if you increase it that exponentially, that's basically absorbing all my grant money. So we really have no grant money to use for anything else. If I'm using all of it for maintenance, then we're kind of stuck, So that's kind of the other factor that I was kind of pushing back on our maintenance costs, where you're going to get our money somehow. I mean, honestly, because we're going to do improvements to the system with the other grant money, but we can't do those if you're taking it off for maintenance. So, You know, and they really, I have to say, were really good to work with as far as, you know, bringing that cost down and, you know, we kind of joked about what services changed by dropping that cost, and the answer was nothing. So, you know, there was some room in there to kind of push back on. And the other thing that I just wanted to talk a little bit about is this month is National Telecommunicators Week. So for those of you who are new or aren't familiar with that, we do kind of some fun stuff week and kind of let staff let loose a little bit. And I've given them some autonomy as far as like during the week, they pick days where like they'll do, you know, everybody dresses in red or everybody dresses down, or they picked a day, I think, where they want to do like prom day or something where everybody's gonna dress, you know, in nice attire. And they just had, you know, we have some fun. We get our vendors involved and they bring pizza in and do a lot of fun stuff for staff. So that's coming up, and we really do try to push a lot during that week as far as recognizing, you know, their efforts throughout the year. And we announce our telecommunicator of the year during that week. And then one of the supervisors actually took on this time, she's gonna do some fun awards for shifts as far as like staff comedian. Let's see, what else does she do? Most likely to help out, person who always picks up the call first, you know, just to kind of like get staff involved, and they're gonna vote together and pick peers for those awards. So we'll keep all of our updates on Facebook so that, you know, everybody can see what they're doing and have fun. But I think that's really all I have. How many resolutions this month?
All right, thank you.
I just want, you did interviews for the.
We did. I'm gonna
You're
announce it this
So it
week.
sounds like you have success there. 'Cause
Yeah.
you're looking ahead to fill it.
I did, yep. So we're gonna announce that this week. Yep.
Supervisors.
The new supervisor, yeah. Yeah, we're still working on that. We really, I hate to sound like a broken record, but we really have to do some of that salary because it's tough. It really is. There's a lot of expectation and not a lot of incentive.
It's still working its way through labor relations, or?
I'm not sure where it's stuck. I've kind of been pushing on HR and Aileen, and I don't want to be a nag, so I'm trying to be tactful about it, but I don't want it to slip through the cracks. So.
What's the telecommunicators week?
It is the week of April 14th. So if you want to pop in, I can let you know what color it is for the day, so you know what to wear.
Let us know the theme.
It's so fun. They really do have a lot of fun. I did thank them this year for doing pajama day on a Saturday, so I didn't have to come in pajamas. Because I do try to participate, but
Anybody have anything else for Denise?
No,
For us?
thank you.
yeah, the week of April 14th. Yeah. Yeah, so I can send you the list so that if you are gonna pop in one day, you know what to wear. Yeah.
Thank you.
Thank you.
Thank you.
All right, next up, assigned council. Lloyd's not here, but. They
Good evening.
Hello there.
So, Lloyd's not here, but, so we don't have any significant, new updates for the month. Obviously based on, the time frame between when we have these meetings, when the month end. It's been a little difficult to get in a comprehensive report preceding month, in time for the change. I think Lloyd has already talked to Cherie about the plan for now being maybe, so say next month, have the report for March, we can cover that, April and July, et cetera, or April and June, et cetera. As far as what data I have for March, I mean, it doesn't, if you've been reading the reports for the last few months, there's no significant difference one way or the other, so. Other than that, everything's on track with Indigent Legal Services. I think we'll be setting up our contract with them for the budget for the next year. Sometime in the coming month, so everything's on track with that, and other than that, no.
We have enough lawyers that have available to.
We're actually, I don't like to speak too soon because we had not too long ago, we were pretty short on attorneys, but right now we have a comfortable amount, I'll say. Yeah. All right. Thank you.
The bucket's not here. The DA, I don't see the DA.
He's coming.
Yeah.
Riley.
Good evening.
Hello.
Yeah, Brittany couldn't make it tonight, so she asked me to come in again. Chris Valdez, Chief Assistant DA. We don't have any formal updates. I just note that we got the conviction in the Gage Ashley murder case after dealing with that for 4 years. We're fully staffed with attorneys. I think everybody's aware, but if you hadn't heard, we got a lot of people from the Oswego County DA's office after a change of experience or change of administration there. We have 3 very experienced people in that office. So fortunately, we're fully staffed now.
Yeah, I just wanted to mention, as far as the conviction that you got, congratulations.
Thanks.
Good job to your staff and office on that.
Thanks. Yeah. Long fight to get that.
Truly, quite a team effort.
Definitely was a team effort. I was co-counsel with Mark Moody, who's one of our new attorneys, very experienced guy from Oswego. We got.
Good job.
Thanks.
Thank you.
Yeah, thank you.
Thank you.
Thanks.
All right, emergency services, Riley.
Good evening, everybody. I don't know if you've heard this, but we have an eclipse coming.
What is that?
On Monday at like 22 p.m. Talk to me offline.
Yeah.
Might be able to make something happen. That's largely been the activity for the last couple of weeks. The activity through the weekend, followed by demobes and hot washes with state homeland security.
Not demobes.
Demobilization.
Oh.
We mobilize, then we demobilize. We got demobes,
Okay,
but we
yeah.
also have
All right,
demobes. I do want to say thank you to a couple of you and those that attended our tier 3 training today. We had 2 sessions. We had 21 this morning and we had 14 in the evening. So that's great attendance considering we almost canceled this round again after we canceled a prior round. Beyond that, everything right now for the next, less than a week is going to focus on April 8th. And we'll have a number of resources staged at strategic points in accordance with our plan, as well as on day of in cooperation with our other local agencies. But beyond that, you have my reports in front of you. Do you have any questions?
I do. Turn over to the numbers there.
All righty.
Thank you.
With that,
Resolutions?
and I have no resolutions this month, so with that, we'll spare you for this one.
All right, thank you, Riley.
Thank you, guys.
Mr. Thomas from Origin.
Been in a year.
Oh, yeah.
Hey, I'm getting done
No.
quick.
You make a lot of money.
Yeah, you really,
You know what?
you can't disguise your voice.
Wish I could make some money with that.
Yeah.
That's what I'm saying. You could be like in the movies or something.
Been
I don't have a whole lot for this month. It's been kind of slow. I mean, with trials and things, we kind of got spared a little bit, so we weren't as busy as we have been, but still working pretty diligently to get things caught up. There, I'm happy to say that 3 officers we have had training in Monroe County are tested in the top 3. So we're with that, and so at least we know we got some good officers there.
That's a 6-week program.
9 weeks.
9. How many weeks do they have left?
They graduate in 2 weeks.
Oh, great. Okay. And they'll be fully trained and ready to go.
Yep, and we'll be sending our newest student to the BCP. Cayuga County's doing, so we're not spending money, and which is great. And one of my supervisors will be probably teaching at least 3 or 4 of the sections. So.
Yeah, so those 3 are in addition to these 2 that are going for the week. That'll hopefully Take a little pressure off.
Yeah, we're hoping that, by, in a couple weeks, we'll be in much better shape. And then I think by, June or so, we'll be in really good shape.
Very good.
Great.
And I have no resolutions this month.
Bless you.
How are you doing to get these few up to staff? I know you encumber upon yourself to take on extra responsibility.
Yeah, between myself and my supervisors, we've been covering the caseloads and then the two hires that we have they've kind of jumped in here and got running and they're very good and they've been able to help out quite a bit, at least helping take reports and things. So we're doing good right now.
That's awesome.
Great. Thank you.
Thank you.
Just pull the sheriff.
Good evening.
Evening.
Now there's a lot of pressure to go quick. Everybody's flying.
Yeah.
It's all on you.
Wait, let me get my timer, my hourglass.
I don't have anything beyond my report, but I wanted to just say that I appreciate Riley bringing the tier 3 training here. And I too appreciate everybody that attended. I think it's really important that we work on emergency preparedness. And, I think we really do need to look at updating our emergency operations center. And I'm hopeful that with the building remodel, that's something that is a priority. And that we support Riley when it comes to that too. And I just want to mention back when the windstorm occurred and we lost part of the roof, we're really lucky that the temperature didn't fall below freezing during that time. With everybody that was without power for 3 or 4 days, if we dropped below freezing, people had their pipes freeze and we would have a long-term potential disaster in a situation like that. So we came really close with that one to having something much more serious where we really would have needed to have a fully functioning emergency operations center. But I just think it's important to note that, these things could potentially happen here. And I think we really need to do what we can to be prepared for those. But I just wanted to thank Riley and thank everybody for attending. So, but beyond that, I don't have anything additional to report. And I do have 3 resolutions.
Does anybody have anything for sure before we get into resolution?
No.
JP1, authorize the sheriff of Cayuga County to enter into an agreement with Lexipol Law Enforcement to provide full implementation of law enforcement policies and procedures, as well provide annual updates and training bulletins for the custody division of the sheriff's office.
Second.
Second. Any discussion?
This is really expanding this out to the custody division, because you've had it before, but during trying to get accredited for the road patrol.
That's correct.
Yep.
For those of you that have been on the board, you did approve me to work with Lexipol for our road patrol division, do the same thing. We are moving it into the jail. They've done a great job for us.
And this would be funded by the telephone revenue account, so
Correct.
And accreditation is the goal there too.
It is. Yeah, things are moving forward with the road and I didn't think we'd be moving this quickly to try to get the jail accredited, but I think that we can do that. So we're moving forward with it.
Okay.
We didn't vote, right? Did we vote?
Okay.
Oh,
Did we vote, Sarah? No.
Yes.
We voted.
we did. I thought we did,
All
right?
right.
We did discussion, but we.
Jonathan says no, we didn't vote.
Right.
Oh, aye.
Any opposed? Gary. All right. JP2, authorizing the sheriff's office to accept funding through the 2023 SLEP. I think that's the acronym there. State Law Enforcement Terrorism Prevention Program grant from the Division of Homeland Security and Emergency Services to support prevention and preparedness efforts and amend the 2024 Sheriff Grants budget to accept 2023 funding.
I'll move it.
Second.
Second. Any discussion? All in favor?
Aye.
Any opposed? Carried. And JP3, authorize the chair of the county legislature and the sheriff of Cayuga County to contract with AEP Enterprise LLC to recover discharge bullets from firearms range.
I'll move it.
I'll second.
Go ahead.
We'll give her a second. Second by Stephanie, any discussion?
So they just take the bullets out and that's what they get paid with?
They do, so we don't have any costs and they take it away, so. And it's way overdue. We've been using that range for decades. I don't remember it ever being remediated and that berm is full of lead. It's time.
Any further discussion? All in favor?
Aye.
Any opposed? Carry. All I have. All right, thank you.
Thank you.
Thank you, sir. Zeke's not here, is he, really? Sheriff?
Nothing I'm aware of. I didn't see it.
All right, I guess, move it.
Second.
Second. All in favor? Aye.
Aye.
Carry.